Following portion of Daytime Tri-Cities is sponsored by HMG.
Breast cancer is the leading cause of cancer-related death for women aged 20 to 39. And during this Breast Cancer Awareness Month, we all need to be aware of the risk factors of breast cancer and also what treatments are available when it comes to breast cancer. And joining us this morning is Dr. Cheryl Stanski with Holston Medical Group to discuss these awareness and treatment issues. Good morning, Dr. Stanski.
Good morning.
Let's talk about your practice. Tell us about your practice overall.
Okay, I am a general surgeon and I've been practicing with Holston Medical Group since 2001. The primary focus of my practice is breast cancer and breast diseases.
Do you have a personal background with this? Is there a personal reason why you decided to go this line of medicine?
Not really, although at this point I feel like all my patients are my personal reason. When I started practice, I did all general surgery, and I still do some, like appendectomies, hernias, that sort of thing. But in my practice, I really enjoyed taking care of my breast cancer patients. You know, it's a scary time for women. There's a lot of education that goes into helping them learn about their options and make decisions. And I really enjoy that relationship I can form with my patients.
And there have been some amazing advancements in technology when it comes to detection and treatment. Talk to me about some of those.
It's true. We've really made great progress over the years. You know, mammograms have gotten better and better. We have 3D mammography now, which is, you know, a little better than regular mammography for some women. We have MRI, so our imaging options have gotten a lot better. Most breast cancers that get diagnosed that I see are really found on imaging, not so much because you can feel them. So they're pretty tiny. And in terms of treatment, that's really come a long way. Surgically, we're less invasive. We don't have to be as aggressive surgically. We've learned that more is not better. And then in terms of other treatments like chemotherapy and pills we give to affect hormones, things like that, we've come a long way in options, and we also are much better at understanding what treatments are right for which women. We can really individualize treatment more.
I was going to ask, how do you make that determination of what treatment avenues to follow?
There are a lot of tests we do, some on the patient and some on the tumor. You know, we can look at the cancer itself and do studies on it to determine how high risk it is. You know, we used to just be able to tell how big it was and whether or not it had spread to the lymph nodes. Now we know if it's sensitive to hormones, if it has other proteins that show it's a high-risk tumor, if it's genetically programmed to behave really badly. And we use all that information to come up with a treatment plan that is for that particular patient.
And let's talk about surgical options. What options are available out there?
Really, there's two main options for a woman with breast cancer. One is breast conservation, where we try to preserve the breast and keep the breast there. With that, we remove the lump with a little bit of normal tissue around it, and we sample the lymph nodes, and frequently do radiation treatment to the surrounding tissue that gets left behind. The other option is a mastectomy, where we remove all the breast tissue, still sample the lymph nodes. You can do that with or without reconstruction. Both treatments are very effective and really equivalent in terms of survival. You know, one is not better or worse than the other, and also really equivalent in terms of recurrence risk. So both very good treatments, and part of the process is just determining what's the right treatment for that patient.
What do you think is the most important factor when it comes to a treatment option?
I think there's a few things. You know, early detection is always helpful. The earlier we find a tumor, the smaller it is, the easier it is to treat, and that gives us more options. And then again, just individualizing care for that particular tumor. You know, some tumors we find them, even though they're small and they might be very early, they're bad actors, and we need to be very aggressive with other treatments like chemotherapy in addition to surgery. Some tumors, they may be a little bigger, maybe have been there a while, but they're just not real aggressive, and we don't have to be nearly as aggressive with our treatment.
Mammograms, so very important. I mean, that is the first line of defense, isn't it?
Definitely. And like I said, that's how we find most breast cancers nowadays. It can pick up a cancer long before anybody can feel it. So, you know, really important to get that yearly mammogram. It's one of those things, you know, women tend to take care of their families and the people around them and forget about their own health sometimes. So October is a good reminder. You know, things are pink, it's Breast Cancer Awareness Month, to go, oh yeah, have I gotten my mammogram? I should really do that.
Do you have a personal story? Do you know of a patient, no names of course, but a patient that a mammogram really just saved their life?
I have so many. I see patients every day who come in. It might be someone who got their first mammogram, just turned 40 and went in and they saw a little something, or you know, someone might have felt something and went and got their mammogram and it was there. So I mean, just patients every single day I see their mammograms found that tumor so that we can start treatment.
What do you think is that one thing that holds people back from getting a mammogram?
I think one is just making the time to do it, you know, but like our diagnostic centers, they do mammograms in the evenings and on weekends, so there's plenty of opportunity. I think there's some fear too, you know, if you don't know about something, you don't have to worry about it. I try to say don't do that, even if you feel something that feels really scary. You know, a lot of times those turn out to be not cancers, and if it is, just because it's big doesn't mean we can't take care of it. So I say, don't be afraid to come in. It's never too late.
Better safe than sorry.
Absolutely.
Always. Dr. Cheryl Stanski, thank you so much for stopping by today.
Thank you.
We got some information for you right here. Check out holstonmedicalgroup.com. If you got any questions, please check out that website right there at the bottom of the screen.
The preceding portion of Daytime Tri-Cities was sponsored by HMG.
Are you looking for the perfect